Hi, I'm Dr. Tim Fargo. I'm the Clinic Director at Chiropractic Health and Wellness Center. Once again, welcome. Today is your report of findings. In a few moments, the doctor's going to come in. He's going to go over the results of your tests, talk about your goals, and discuss with you various treatment options, what it's going to take to help you achieve those goals. The information that he's going to be going over is very important. This is an introduction so you can better understand what he's going to be discussing with you. To begin with, the primary objective is to make sure that we get and keep you healthy throughout your whole life. The primary controlling system in the body is the nervous system. It consists of your brain, which is being protected by a hard bony shell, your skull, and your spinal cord and the associated nerves, which are being protected by and influenced by a flexible bony tube called your spine. As long as your nervous system can function properly, you will have the potential for great health. There are various things that can influence and impact the functioning of the nervous system. One of those things, and the primary thing which as a chiropractor I identify and treat, is called a subluxation. A subluxation is a misalignment or loss of normal movement of the spinal bones, which creates nerve interference and or irritation. When you have a subluxation, it has impacts locally and more globally in the body. The global impact of subluxation is that these areas in the spine that are no longer moving and working properly are basically stress events, which stimulate stress response in the brain and have a host of different negative health consequences. The more local impact of subluxation is that they will cause irritation, inflammation, muscle spasm, muscle imbalance, loss of motion, and very significantly can impact internal organs and muscles that are associated with that spinal level. As an example, a person can have a subluxation in the lower neck, which can create a loss of strength, numbness, tingling, weakness, and pain into the arm. Similarly, a subluxation in the low back, while it can create problems with the legs, could also cause problems with the bladder, colon, rectum, reproductive organs, that sort of thing. So it's critical for us to identify your subluxations, and that's what we're going to be doing in just a moment. One thing that's very important to understand is the relationship between subluxations and problems in the body more generally and whether or not a person has symptoms. Just like it's possible to have heart disease, some forms of cancer, diabetes, high blood pressure, and not have any symptoms at all, it's also possible, and quite likely in fact, that you could have subluxations in your spine and have absolutely no symptoms. The flip side, of course, is that you could very well have significant symptoms associated with them. Subluxations have functional aspects associated with them, meaning having to do with movement, but they also have structural aspects as well, which relates to the architecture, the arrangement, or alignment of the things. The normal architecture or structure of the spine, when you look at a spine from the front or from the behind, it should be nice and straight. When you look at a spine from the side, however, it has gentle, undulating, or smooth curves. The curves are designed to allow you to absorb shock and carry loads properly. When you look at a spine, as you're going to in a moment, if we took x-rays of you, your x-rays will show us how straight you are from the front or back and what your curvatures are like. If the curves are not correct, either too great or too small, or the spine is not straight, we know that's predictive of the fact that you may have problems with your spine and it can cause damage or degeneration over time. For illustration purposes, I'm going to show you an x-ray of the neck as seen from the side. As you can see, a normal curve is smooth and the spaces between the vertebrae, which is occupied by a disc, are nice and uniform or even. This next image illustrates what we call phase 1 spinal degeneration or decay. What you'll notice here is that the spacing between the vertebrae is no longer wide or uniform. Some may be bigger and some smaller. You may also see, and you can see here, a loss of the normal curve and sometimes even a reversal. In phase 2 degeneration, what you can see pictured is that the spaces between the vertebrae have become progressively smaller, and very significantly, you see the beginning of spurs around the edges of the vertebrae. When this starts to occur, the nerves which are exiting now have less room. Also, the spinal cord has less room. Finally, we have phase 3 degeneration. In phase 3 degeneration, the spaces have become even less, the bone spurs progressively larger and more pervasive. The body is, in a sense, attempting to fuse these affected areas. It's critical to understand what phase of degeneration you might be in, because it tells us, 1, how long this problem has persisted, and 2, very importantly, what your potential for recovery is. I think it's critical to understand that even if you have later stage degeneration in the spine, there are still tremendous gains that are available to you in terms of functionality. In a few moments, the doctor will be coming in to discuss with you what we found on the examination, what your health goals are, whether we can help you, and very importantly, what the treatment options are. I hope this short video has been helpful for you, and we're very much looking forward to helping you.